Hello, my name is Greg Starbuck. I'm a licensed therapist here in California, and I love to do these little vignettes, these little shorties, on a particular topic or interest for folks that are in this profession or just enjoy the topics or therapy or Christian interaction or whatever it may be. And these are only for education, just information, and maybe a little entertaining from time to time. But don't ever use this for therapy. That's not what this is for. This is just for kind of things to talk about that I enjoy chatting about. And if you need some help in a particular area and you're struggling, just contact somebody local and see if you can get an appointment with someone locally to work through whatever you want to focus on. Well, today's topic is a really, really interesting, I think, and it's been a controversial topic for a long time, as long as I can have been doing therapy, and it's been a long time now because I'm old. But the idea here is that we were looking at medications and therapy. Oh my gosh, what a hotbed, right? Well, let me kind of give you a little education on this and for you just to think about, right? That if someone is in dire straits, right, sometimes the chemistries in our body are so depleted that we are struggling medically and psychologically and emotionally all at the same time. So it's kind of a challenge to do therapy with someone who's severely compromised in these areas. It doesn't mean you can't do it, right? Doesn't mean that at all. But when I meet someone who I know is struggling, and I always recommend, as I've mentioned before, that they see a physician, get some lab work done, get a physical done, right? Make sure you're kind of in decent shape there. You could be pretty darn depressed maybe sometimes, and you just can't get to a therapeutic milestone because you're just dragging so bad, and generally for some really, really good reasons. But it's tough to really get some work done for some of the cases that we work with, that if the medications aren't in place, they could take a couple weeks to a month, depending on the medication. But the idea is that sometimes your chemistries are so depleted that regardless of what the therapist is talking about, you're just not in position to act on it. So I recommend that folks, when I see that it appears to be necessary, I make a suggestion they see a physician, get the lab work done, and quite often, that prescribed medication helps them come up a little bit. Maybe it's been a severe loss and they've been in one of those stages of grief that they're just not getting out of, and they're stuck. They're just really stuck. So they need maybe just a little help to get the chemistries going again, right? That are so depleted to help you feel up a little bit and ready for the new day. Then we look for to have some balance between the medication management and the therapeutic approach. So the idea is that as we gain in our therapeutic understanding and gain some ground, I make a suggestion when I have a sense the timing is right, that they talk to the physician again and take another look at the medication, and perhaps he'll say, no, I think I want you to go a little bit longer or whatever, or it's time to decrease it a little bit. And so as your mood improves, right, then the medication decreases. Now, this is a decision made by the physician or psychiatrist. I don't make that decision. I may make a recommendation because I see progress, and your physician or psychiatrist may not be seeing you as often as I do. So I may make the recommendation that and this is not a reflection on the psychiatrist or the physician following your medications, but this is the kind of the daily operations of someone like me helping someone and then letting that psychiatrist know or physician know, either in person or via phone call, or an encouragement of the client to actually interact with the physician or psychiatrist on reevaluating the medication, right? Now, I've worked with clients who've been on the same medication for many years. You go, oh my gosh, this one may have fallen through the cracks. So ask, want you, well, I haven't even seen my psychiatrist in years. They just refill it. And so, kind of an encouragement, maybe schedule an appointment and kind of see where you're at, because sometimes you get an abundance of medications coming from different directions and it's not helping you as far as a therapeutic approach, right, to help, because you're over medicated. And again, these are decisions made by the psychiatrist, not by me. And these are made by the physician, not by me. And we need to keep that clear that medications and therapy can work very well together if they're managed well, and that the idea is that you decrease the medications clinically to a point where the function is just right and the growth is occurring therapeutically also. So anyway, that's just a little something on medications and therapy, and it's always kind of an ongoing thing to figure out. But for some of us that've been in the industry a long time, it's pretty clear cut on how to work it and how to work with a physician or psychiatrist to have that looked at. And I've never met a psychiatrist and or physician that wasn't willing to take a look at this because they sense the best interest of the client or best interest of the patient, whichever you want to look at it there. But anyway, don't take my word for this. You ask your physician, right? Not me. I'm just enjoying the topic with you today. So anyway, that was one of the great topics that comes and goes for me in my industry. Well, God bless, and we'll see you on the next topic. Bye-bye.